Good afternoon, everyone, and welcome to our webinar on the CTCMPAO standard for record keeping and what TCM practitioners need to know. Thank you for taking the time to attend our presentation. My name is Anne Zeng, and I'm the Registrar and CEO of the college. We want to thank everyone for continuing to follow the Ministry and the Public Health guidance for risk assessments, screening, PPE, infection control, social distancing, and guidance for prioritizing healthcare workers for COVID-19 vaccination. Your continued efforts and commitment to protecting your patients, staff, and community are greatly appreciated. Today's webinar provides an opportunity for you to better understand the standard on record keeping. The presentation is pre-recorded. However, we will be answering questions at the end of the webinar. We have enabled our Q&A feature, and if you have any questions throughout the webinar, just type them into the box, and we will do our best to answer them. You can also send your questions to the college by email later, and we will answer them as soon as possible. We will have a recording of this webinar available for you to access later. We will be providing a certificate of attendance for this webinar, but would like to remind everyone that you can still record your professional development activities in the professional development log, which can be found on the college website for download. I'm happy to be joined today by Sean Kessman and Amy Lee. Sean is the Policy and Governance Analyst, and Amy is an RTCMP and RAC who currently works as the college professional practice advisor. Our registration and QA manager, Anya Walsh, QA associate Jennifer Nguyen, and communications coordinator Aaron Ma are also online to support the webinar. So thanks everyone. Without further ado, we'll begin our presentation.
Good afternoon, everyone. Before we start, I wanted to remind everyone that the standards of practice and associated guidelines can be found on the regulation tabs on the college's website. We recommend that you bookmark or download a copy of the standard and guideline for easy reference. Under the Record Keeping Guideline tab, you can find several record keeping templates. These templates can be downloaded or formatted to suit your practice needs and design. The standard for record keeping was first approved by the college's Transitional Council in 2013, and the updated version came into effect on January 1st, 2021. No significant changes were made to the standard. Clarification was provided on the record translation, and references were updated. For practitioners, maintaining a proper record is essential to delivering safe, quality, and ethical patient care. Patients have the right to expect that the records are accurate and easy to understand, complete, and kept private and secure. Maintaining proper records is important for practitioners and patients. Detailed and up-to-date records will help you recall a patient's medical history and previous treatments. When a patient receives care from another healthcare provider, complete and comprehensive records assist in the continuity of care. As such, key information in the records must be understandable to other TCM practitioners and other healthcare professionals. Comprehensive records also help save time and resources from conducting redundant examinations. Having complete and detailed records also protects members when information is requested from third parties, such as insurance companies or the college when investigating a complaint. Patient records are legal documents. They provide legal protection for the practitioner and for the patient. The bottom line is that anyone authorized to review the patient record should understand what conversations took place with the patient, what assessment was performed, and what treatment was provided. A patient record should show treatment progress and reasoning behind care decisions. We will be going over this standard's 4 principles during this presentation, which are: 1. Members must follow basic rules for recording and formatting patient records. 2. Members must maintain required records to support their practice. 3. Members must safeguard the privacy of patient records. And 4. Members must retain records for the required periods and destroy them safely. Principle 1. Members must follow basic rules for recording and formatting patient records. This means that members must manage patient records in a way that makes finding and retrieving records efficient. The records can be either on paper or electronic, and they must be clear, legible, comprehensive, and accurate. And now Amy will discuss how to apply Principle 1 to practice.
Thank you, Sean. We will now review some best record-keeping practices. To maintain patient records, practitioners should create entries as soon as possible after the patient visit or no longer than 24 hours after the visit. Define all short forms used. The use of commonly accepted abbreviations such as shortness of breath for SOB or ROM for range of motion, these are generally recognized by professional peers, which are allowed. Abbreviations that are obscure or personal should be avoided. In an emergency, a non-consulting TCM practitioner should be able to understand the record. Include a patient identifier and page number on each page of a record. Maintain pages of a record in chronological order. Date each entry in a consistent format. Sign each entry, update and correction, and note when another person took part in the patient's care. For example, when another person provided the treatment, made an entry, or translated. When updating or correcting records, practitioners must not change the original content of an entry. Information can be added to make an update or correction, but you must never remove original information. While records may initially be recorded in a language other than English or French, members must also translate the records into English or French soon after the original record is made. The college's standard of record keeping states that records must be translated into one of the two official languages in a timely manner. Members must be aware that requests for records can come at any time, and it is the member's responsibility to respond to those requests without delay. Failing to respond to the request for records in a timely manner because of the records have not been translated could be considered a breach of the standard of practice. Therefore, members must have a procedure for translating records that allows them to respond to unexpected requests for records. Sean will now explain Principle 2.
Principle 2. Members must maintain required records to support their practice. This means that members must keep patient records, financial records, and records of the supplies and equipment used in their place of practice. Amy will be discussing the application of this principle in the following slides.
Firstly, members must maintain a written or electronic daily appointment log. The log must contain appointment dates recorded in a consistent format, the surname, first name, and/or initials of each patient, the time and/or duration of the appointment of each patient. Each individual patient record must contain a patient health summary, which can include surgeries, medications, as well as allergies, all notes and signed documents related to informed consent. A healthcare professional must obtain informed consent for all treatment we provide. Consent may be obtained in writing, verbally, or it may be implied. However, we strongly recommend that members ask patients to read and sign a general consent form before starting treatment. Samples of a general consent form and consent form for treatment of sensitive areas are available on the college website. Members must continue to ask for consent if anything about the treatment changes. A note of the patient's verbal consent to specific treatments should be kept in records. We also recommend that the members review the standard of consent and contact the college if you have any questions. To continue, the patient record must also contain assessment and diagnosis information, treatment information, progress and follow-up notes, referrals from and to other healthcare professionals, copies of the reports from other healthcare professionals, and any information on ending the patient-practitioner relationship. On the following few slides, I will provide some examples for the initial assessment and follow-up treatment records. Let's start with the initial assessment and treatment form. The patient's name and date of treatment must be filled out. The file number is optional and will depend on the record management system used. The chief complaints should be clearly stated and identified. Also, note the duration of the complaint. When counseling with the patient, practitioners should list the patient's current symptoms here. As a reference, the college template includes the 10 questions at the bottom of the box. Reference terms have been provided for your convenience. The TCM treatment plan should be described here. It should include information about the recommended modalities and length and frequency of the treatment. It is highly recommended that the acupuncture points used in the treatment be documented with the numbering detailed in WHO standard acupuncture point locations in the Western Pacific region. This is also a really good place to put information like the gauge of the needle, the amount of needles used in this treatment, the sensitivity of the patient, whether or not this is the patient's first time receiving acupuncture, whether you used a heating lamp or an electrical stimulation machine, the method of needling, and also whether or not you were needling bilaterally or unilaterally. So it's very important for you to document as much information as you can about the treatment so it allows for somebody else to be able to follow and for you to recall very quickly. The name of the prescribed herb has to contain 2 sets of information. The practitioner must include Chinese characters, simplified or traditional, or pinyin and medical latinate or botanical name. The type of herbs, quantity of herbs, how to prepare them, how to store them, and frequency of treatment should all be stated clearly. Records can be in your language of choice. However, records must also be transcribed in English or French. When prescribing, you are responsible for the completeness and accuracy of the information that is provided on the prescription. The TCM prescription should be legible and should contain all necessary information to allow the prescription to be accurately and safely dispensed, used, and tracked. The information in the prescription must be useful to and understandable by any health professionals, especially in emergency situations. Practitioners must sign and date the initial assessment and treatment record when completed. And here is an example of a completed follow-up treatment record. This is a simplified form used for subsequent patient visits. The intent of the follow-up treatment record form is to document ongoing treatment progress and document any changes in the prescribed treatment if required. A separate follow-up treatment record is required for every follow-up visit. This is an area where you can document whether there was any adverse side effects to the treatment prior, how the patient reacted to the herbs, and whether or not you need to continue with the herbs or change your prescription with your acupuncture points. The record should reflect the ongoing progress of the patient's health. For financial records, members must keep a record for every patient to whom a fee is charged. This can be stored in the patient's health record, in the member's accounting records, or both. If the receipt is a duplicate, this must be noted. Members must be able to provide an itemized account of fees if a patient or a third-party payer, for example, insurer, requests it. We will review what information is required on an invoice on the following slide. The college does not currently have a template for receipts and bills. However, a patient's receipt must contain the following information: members' registration information, names of others involved in the care, for example, students or staff members, the clinic name and contact information, the patient's full name and contact information, date and duration of the service, an accurate description of the services and products provided, type of payment used and amount received, any balance on the account, HSG registration number if applicable. Members must keep records for their supplies and equipment used in their practice. For our TCMPs that use traditional Chinese medicine herbs, the supply record would include date of purchase, date of expiry, supplier information. For equipment, the inventory record should include date of purchase, supplier information, equipment maintenance information, including inspection and servicing, expiry dates for needles, as well as the dates of which you dispose the containers for the sharps boxes, as these are biohazardous materials. Lastly, and particularly important at this time, records of infection control procedures should also be kept. This may include cleaning and disinfecting, as well as the expiry dates for PPE. The following is an example of equipment maintenance log. All equipment used, including devices such as CPR equipment, scales and slicers, must be maintained according to the standards listed by their manufacturer or supplier. All relevant information should be maintained in a logbook. Practitioners must detail, maintain, and keep an inventory of every instrument or equipment used for any service to the patients, sterilization of equipment if used. This can include equipment such as cupping instruments and other equipment where blood is involved. Other equipment service records as necessary. With the COVID-19 pandemic, infection control procedures are more important than ever. You may wish to consider keeping a cleaning log to record the times and clinic areas that are sanitized throughout the day. And now Sean will explain Principle 3 of the standard.
Principle 3. Members must safeguard the privacy of patient records. Members must comply with the laws that protect the privacy of personal and patient health information. The Personal Health Information Protection Act, or FIPA, outlines these duties. A health information custodian is the person or organization responsible for all health records. The custodian must create, implement, and oversee a privacy policy that meets the requirements of FIPA. A sole practitioner is the custodian of any health information and records that the practitioner collects. For example, an acupuncturist who works in a solo private practice would be the health information custodian for their practice. An agent is a person who is given responsibility to use the patient's records for the purpose of treatment. If you work for or on behalf of another custodian, such as another regulated health profession or a group practice, then you are considered to be an agent of that health information custodian. Amy will now explain how this applies to practice.
Each patient record must identify the person in the practice who is the health information custodian. This means that members must list the health information custodian and the agent of the information custodian, obtain patient consent for collecting and using and sharing personal health information. Although PHIPA does not require practitioners to use consent forms, CTCMPAO strongly recommends them. The college website has a copy of a template for consent to collect, use, and disclose personal health information form. Remember, patients' express consent is required where personal health information is disclosed to a person who is not a health information custodian, or it is disclosed for a purpose for other than providing health care. For example, fundraising or marketing. Store and transfer records in a secure manner. Respond to patient requests to access and correct personal health information. Remember, the patient or anyone whom they give consent should be able to access the record throughout the retention period. Ensure that those involved in taking care of the patient records are trained. Have a process to detect and respond to a privacy breach. Sean will now discuss the final principle of the standard.
Principle 4. Members must retain records for required periods and destroy them safely. This means that members must retain patient health records and financial records for 10 years from the date of the last patient visit. For patients who are minors, records must be kept for 10 years after they turn 18. Members must also retain traditional Chinese medicine herbs and equipment records for 5 years from the date of the last entry in the record. Members must destroy records in a secure manner that prevents the reconstruction of the records. Members must establish a succession plan in case they are not able to retain the records. This plan should establish who will be responsible for retaining the records until the end of the required period. Amy will now discuss how this principle applies to practice.
As mentioned by Sean, members must retain patient health and financial records for 10 years from the date of the last patient visit. This requirement includes all other files for example, appointment logbooks. At the end of the retention period, you will need to ensure that information is permanently destroyed in a secure manner. This applies to both paper and electronic records. Practitioners who practice in a group setting need to consider a few additional factors. For example, if a member leaves a group practice or the practice dissolves, members must ensure that they can still meet their professional responsibilities for the required periods. This means that they must maintain the patient records they are responsible for and keep copies of the patient records or ensure that they still have access to them. Members must give notice to patients when the health information custodian changes. This could happen, for example, if a practice relocates or changes ownership. Patients must have the option to obtain the copy of their file or consent to the transfer of a copy of their record to another health information custodian. Members should give each patient notice personally, either during a scheduled appointment or by letter or by phone. This concludes the main portion of the presentation. We will now move on to the question and answer period.
Okay, so the college has received a number of questions regarding record keeping, and we're going to share a few of them with you now. So I will read out the questions and Amy will give an answer to them. So the first one, I'm interested in transferring my paper records to an electronic filing system. What do I need to consider before doing so?
So that's a really great question, Sean. Members will need to ensure that the information can be secured and backed up accordingly if moving to an electronic system. All records must be secure from loss, tampering, interference, or unauthorized access. This may mean using multiple passwords, hard drives, or an electronic record management program. You must also have a plan in place in the potential event of data loss. The Office of the Information and Privacy Commissioner of Ontario has information on safeguarding personal health information stored electronically.
Okay, great. So the next question, who can access my patient records?
A practitioner can share personal health information with other individuals within a patient's circle of care for the purpose of providing health care without the patient's express consent. A circle of care may include other health professionals to provide care to the same patient, such as a physician, massage therapist, acupuncturist, or other osteopathic healthcare people. A practitioner may assume that they have a patient's implied consent to disclose personal health information to other health providers in the patient's circle of care. An exception to the circle of care rule is that if a patient or patient's substitute decision maker says that he or she does not want the information to be shared, the practitioner should document whether the patient places any limits on their records or if the patient later withdraws their consent or part of their consent. This is known as the lockbox provision. This means a patient is locking all or part of their health information from access by other healthcare providers. There may be some other circumstances when consent is not required. For example, if there is a significant risk of serious bodily harm, or when records are released to a regulatory college, for example, in the context of an investigation or complaint. For third parties, such as insurance providers, to access treatment records, patient consent is required. The college recommends that members have their patients complete the consent to collect, use, and disclose personal health information. It's a form to assist with claim verification.
Okay, so our third question here is, if I offer telepractice, what information do I need to provide on the invoice?
So practitioners engaged in telepractice must comply with all existing practice requirements and standards, including the standard of record keeping. Practitioners are also required to advise patients of fees prior to providing the treatment. Practitioners are also expected to advise their patients upfront of any additional fees associated with the telepractice. The fee information must be clear and should not be misleading or hard to understand. Invoices should be accurate representation of the service provided to the patient. If applicable, an invoice should indicate that a service was provided remotely. Practitioners should advise their patients to check that insurance providers cover services provided by telepractice. You must document all patient encounters that take place through telepractice. Patient records should clearly indicate when a service was provided remotely.
Great. So if I practice out of multiple locations, is it appropriate for me to simply choose one location for the invoice?
If a practitioner works in more than one location, their financial records should accurately reflect which clinic the treatment was provided out of. As a reminder, if there are any changes to your current workplace location, please update the college within 30 days of the change.
Okay. So I am currently practicing in a multidisciplinary clinic, and the clinic has ownership of the patient records. If in the future the clinic closes, how do I fulfill my responsibility to retain access to patient records?
Well, the college recommends that the members practicing in a group setting have a written agreement that clearly establishes the responsibility for maintaining and transferring records upon the dissolution, resignation, or termination of the practice. Usually, patient record agreements will address items such as the consent of the records in order to respond to college investigations and/or requests from insurance providers. The college's record-keeping guidelines lists options available to the practitioner to ensure future access to the patient records. So I'll just list them out. Number one, a practitioner is given full access to the patient health information records to fulfill a professional obligation. This may include an in-person visit to the practice location, or number two, a practitioner keeps the patient health information records and gives full access to the previous clinic to fulfill their professional obligations. Or number three, a practitioner creates a copy of the original patient health information records with him or her leaving the original with the clinic. So the original copies get left with the clinic. This may involve photocopying or creating an electronic copy of the records. So it's important to remember that the patient is entitled to full access to their patient health information. Upon dissolution of the practice, a member must be able to retain access to the records. If a member has resigned or terminated their practice, the patient must be noted of the location of the practitioner or custodian that may be retaining the records so that the patient may be able to make arrangements on how to access their records.
Thank you. So number 6, I will be transferring to the inactive class of registration. What are my responsibilities regarding patient records?
Members who intend to close their practices, resign, or leave an existing practice must provide their patients with notification of practice closure or restrictions as soon as possible. In order to allow patients an opportunity to find a new practitioner, they must assist with the transfer of patient care to another provider. This includes copying the file at the patient's cost and transferring patient files to another practitioner, or simply just giving a patient a copy of their file.
Okay. So next is an insurance representative has requested access to my patient record and has provided a signed authorization form. Can I provide them with the information requested?
The college strongly recommends that practitioners use consent forms as part of their record-keeping practices. The college has a template that can be used by patients to permit disclosure of personal health information. As long as the members are provided with current, clear, and legal authority to disclose personal health information, they will not be breaching the standards of the college or the Personal Health Information and Protection Act.
Okay, and we have one more question. I think I can answer this one. So it was mentioned to get consent for sensitive areas. Is it necessary to get written consent, or is verbal consent okay? And is this similar to the new rule of the RMTs? So the first part of the question, yes, you do need to get written consent for the initial treatment. So when you first see the patient and you determine that contact with sensitive area is necessary, you will need to get written consent for that. However, for follow-up treatments, verbal consent is okay. You don't need to get written consent for each follow-up treatment. And is this similar to the new rule for RMTs? Yes, it is similar to the rules for RMTs. I believe RMTs will need to get written consent for this as well. I don't know exactly if it's exactly similar, but it is quite similar. Oh, and we just received another one. Can I receive the samples and forms for keeping record of today's seminar file? So I guess I can answer this as well. The forms that we showed in the presentation are available on our website. So if you go to our website, they are in the resources section. And you can save them and have them available to you. Like mentioned, you can make changes to them if you want to suit them better to your needs. But you should be keeping all the information that is there available. Okay, we're getting some more in now. Please keep sending your questions if you have them. So next one, I haven't been including gauge of needles and number of needles in the treatment note. Do I need to start including these informations? Amy, do you want to maybe take this one?
Yeah, for sure. So although it's not mandatory for the college record keeping for you to have that information, as a practice advisor and somebody who sees patients on a daily basis, sometimes I forget which gauge and how many needles I would use. I know the points because they're all written down. It's just sort of one of those things that help me remember if the patient is sensitive or not, if they've received acupuncture. So this helps me to connect with the patient a little bit better if I write down the gauge and say, oh, you know, we used 0.22 last time. Is it okay if we try something a little bit different, or were you still very, very sensitive? Or also people who just might not have had acupuncture in the past. And it's just useful information to have when you jot these things down for yourself. Also, if you have a multi-person practice inside your clinic setting, if you have 2 or 3 people that do the acupuncture for your patient, it's just important to make sure that all of those messages get across and that they have that information for the care of the patient. So it's usually for the comfort of the patient.
Great. Someone asked, do you have any suggestions for approved record-keeping softwares? Unfortunately, we can't make suggestions. Just sort of as a non-profit organization, we can't be making any type of recommendations for private companies and things like that. But I don't know, Amy, if you have any things to look for, what would be good, or
The college website does have a template for necessary information. So with the peer and practice assessments that I do on a regular basis, I always get the members to refer to that document. It does have helpful information. You can change it on your own. All of the everything is fillable, so you can change the name, you can change the size of the boxes to suit your own personal preference. However, the information is all there. So we do provide a very, very good template specifically for consent as well as for the intake form and the follow-up treatment form too.
Great. Just seeing if there are any last questions coming in. If not, I might turn it back to Anne for closing remarks.
Well, thank you, Sean and Amy, for sharing your knowledge with us today. Oh, sorry, I just noticed that there are actually more questions coming in. I'm not going to just close the webinar right now. Let's give the attendees a few more minutes.
Yeah, so sorry, we're getting a bunch of questions flooding in now, so just give us a second. Just to let everyone know that if we don't get to every single question, we will address them eventually as part of an FAQ. We will be posting this webinar on our website, and attached to that will be an FAQ that answers all the questions we get today. So if we don't address every single question right now, please look for that, and we will let you know.
Yeah, and also, as we mentioned that when you're looking at your record keeping standard, maybe also cross-reference with the standard for consent. I noticed that a lot of questions are related to consent, so that's another important standard you need to understand. I saw another question. Will the college be developing in the future any electronic record keeping platform? That's a very good question. I don't think I have an answer at this moment, but we can definitely discuss this with the QE committee, see what options we have as a regulatory college. And there's another question related to consent. It was mentioned to get consent for sensitive areas. Is it necessary to get a written consent, or is verbal consent okay? So Sean, I'll pass it to you.
Sure. I did mention briefly that written consent is required for the initial treatment. So when the patient first comes to you, you will need to get written consent for treatment for sensitive areas. However, after that, for follow-up treatments, there will need to be express consent. So that could be verbal. It does not need to be written for the follow-up treatments. So hopefully that answers the question.
The next question, yeah. Sean, go ahead.
Yeah, so for follow-up treatments, do we need to keep a separate page for each treatment, or can we do multiple treatments on one page? Amy, I can pass that to you.
As long as it's documented, it doesn't really need to be on separate pieces of paper, as long as you are dating it correctly and following the guidelines on how to properly keep that record. So the multiple pages is not really an issue. You can have it on the same page, but it just needs to be properly dated.
Okay. So would you have a recommendation for a template for consent for sharing information with other practitioners?
I believe the college website has a consent form to collect and release information. That should be found with all of the other documents. So even though it is not mandatory, for privacy purposes, it's always a very, very good idea just to have it in place, because sometimes insurance companies do call the office and say such and such person was here for a treatment, and you need to know whether or not you're able to release that information if you have the consent of your patient.
Okay. So I see for in-home visits, is there any additional information that should be on the invoice?
As I mentioned before, as long as it's clearly documented on your invoice that it was an in-home visit, whether it's in person, in the office, telepractice, as long as it's properly documented on your invoice, your patient knows exactly what they received and it's clearly marked on your invoice, that's the most important information, that they just need to know what occurred, whether it's telepractice, in-person, house call, or what have you. It just needs to be individually documented.
Okay. This was touched on briefly during the presentation, but just to reiterate, so how long should we keep inactive patient files before shredding them?
So as mentioned in the presentation, it's 10 years.
Yeah. Unless the patient is under 18, then it's 10 years from the date they turned 18. Okay. One more.
Yeah.
So with regards to the updated standard for billing effective April 1st, the guideline requires the patient's name, address, telephone number on the invoice. In the past, some patients disliked having their phone numbers on the receipts and invoice. Please advise on what to say or do if that comes up again. Amy, do you have any response for that kind of information?
I think we're going to have to get back to you on that one.
Okay.
I don't have an immediate answer. I think I know what I want to say, but I just want to check with the college record keeping first.
Sure. Yeah, so an answer to this should be provided in the FAQs.
I see another question. Are we allowed virtual practice? I do think the college has released a telepractice statement during the pandemic. It is available on the college website. So I would say refer to that statement. And also, I can confirm that practitioners are allowed to practice through telepractice right now, but there are a lot of detailed rules that you have to follow to ensure patient safety. So we will get back to you on that one to send you a link, but I'll also ask you to go to our website. It's on the website. Sean, do you have anything to add to it?
I guess I could just say that the Chief Medical Officer of Health for Ontario has asked that healthcare practitioners use telepractice and virtual care when possible to limit in-person treatments just during COVID. But like Anne said, there are some things you need to be mindful of. So please do read our telepractice position statement so that you're fully informed.
Okay, I think it's about time for us to close this presentation. So again, thank you, Sean and Amy, for sharing your knowledge with us today. As a reminder to our registrants, the webinar will count towards your professional development hours. Any questions that were not answered today will be addressed later. As I mentioned to you earlier, the recorded webinar will be available on the college website at a later date, along with the FAQ. So I hope you enjoyed today's session, and thank you again